Week 2, Mental Health. Who is most at risk of PTSD? Veterans and those in dangerous jobs or dealing with secondhand stress, trauma, etc. Police, fire, healthcare, military, and spouses. People who have experienced an adverse childhood event. Those with family history or personal history of other mental health disorders or substance abuse. Minority groups and women. Fight or flight, fawn or freeze. Fight, stand up to the danger, face the stressor or situation ready to confront it or fight. Flight, run away from the danger, flee from the stressor or situation. Fawn, try to appease the situation, attempting to please or give in to the stressor. Freeze, do nothing, feel stuck, unable to respond or react against the stressor or situation. What is an ACE, adverse childhood event? An ACE is a potentially traumatic event that occurs before age 18 and can have lasting effects on a person's health, development, and well-being. Abuse can be physical, emotional, or sexual. Neglect can be physical or emotional. Household dysfunction such as domestic violence, substance abuse, mental illness, and parental separation. Family member incarceration is also included in this. Historical trauma. Historical trauma refers to the cumulative and emotional, psychological wounds passed down across generations due to massive group trauma, such as genocide, slavery, forced displacement, and colonization. It's trauma that doesn't end with one generation, and it's carried through families and communities, often silently. It's widespread and chronic, and it might show up even if the current generation didn't experience the original trauma in their lifetime. It's linked to race, ethnicity, nationality, and culture. How do trauma-related disorders develop? When someone experiences trauma, like abuse, violence, or a disaster, the brain activates the fight, flight, or freeze, fawn response. This is meant to protect them in danger. But when trauma is severe, chronic, and ACE, or with no follow-up support, the stress response system stays stuck in high alert. The brain and body get overloaded and they don't return to normal. Brain changes over time. With chronic trauma affects amygdala, becomes overactive, increases fear and anxiety. Hippocampus may shrink, it affects memory and learning. Prefrontal cortex underfunctions, affecting decision-making and emotional regulation. Overall, this can lead to intrusive memories, hypervigilance, emotional numbness, difficulty concentrating, and trouble forming safe relationships. Stages of anxiety. Mild is restless, fidgeting legs, tapping hands, etc. Moderate is insomnia, dwelling on the problem. Severe is overwhelmed, acting out, unsure what to do. Panic, sense of terror, exhausted, no longer able to respond to stimuli, and they also say not able to make eye contact or keep eye contact. Eustress versus stress. Eustress is positive stress, such as college, graduation, having a baby, marriage, buying or building a house, a vacation. Stress is negative stress. It depletes energy, causes exhaustion. It's death of a loved one, financial problems, divorce or conflict in relationships, legal problems, abuse or neglect, hospitalization, injury or illness. Manage stress with self-appraisal and awareness of the stressor, and self-regulation, which is easier said than done. Prolonged or chronic stress can teach the body to remain in a state of fear, fight or flight, and it can cause biological and neurological changes. A good support system can help reduce stress. What are some common phobias? Arachnophobia, acrophobia, claustrophobia, trypanophobia, cynophobia, nyctophobia, thanatophobia, and avoidance is the key to diagnosis. Aggression versus anger. Aggression. Actions lead to physical harm. Anger. An intense emotion with positive and negative effects. It can include swearing, sarcasm, breaking things, but not often followed by an aggressive act. Generalized anxiety disorder versus anxiety. GAD is a condition where you worry constantly about everyday issues and situations. Healthcare provides diagnosis of GAD when worrying happens most days and for at least 6 months. Patient may also feel restlessness, extreme tiredness and fatigue, trouble focusing, grouchiness, muscle tension, and insomnia. Treatment may include meds, counseling, relaxation methods, exercise, and lifestyle changes. Patient may also suffer from depression and other health conditions. Stalking, an unwanted attention and harassment. The stalker is often known to the victim. They follow and watch the victim and will obtain entry to the victim's vehicle and house, leaving items to show the victim that they have been there. They often show up unannounced to the home and workplace and school. They will call, email, and text. What is a SANE nurse? Sexual Assault Nurse Examiner. It's an RN who's had advanced education in forensic examination of sexual assault survivors, also called Forensic Nurse Examiner, FNE. They conduct focused genital exams, preserve specimens and collect evidence, debrief traumatizing situations, administer meds to prevent or treat STIs, and may provide expert testimony in legal proceedings. Pharmacogenetic testing. Also pharmacogenomic testing. It helps predict whether or not a patient will respond to meds, need a higher dose, or have serious side effects. Non-suicidal self-harm. Reach out immediately. These are interventions. Reach out immediately, phone or text, to a trusted person or psychosocial professional service. Explore creative avenues of expressing emotions, coloring, drawing, journaling. And recenter thoughts and emotions by focusing on things that interest the patient. Perpetrator versus the victim. The perpetrator has excuses and rationalizes behavior. The victim blames themselves for the reason for the abuse. The perpetrator is non-communicative and no attempt to cooperate or develop solutions. The victim feels like there's no resolution to behaviors. The perpetrator uses intimidation to control. The victim doesn't feel like independence, either emotional or financial, is possible. The perpetrator uses sex as a method to relieve unwanted thoughts, or they also use pornography. The victim has a lack of sexual desire to engage in sexual behavior, poor boundaries of sexual engagement with others. Detox relapse plan. Understand external triggers, people, places, things. Understand internal triggers, emotions, thoughts, physical states. Develop a coping toolbox, mindfulness and relaxation, physical activity, creative outlets, and support calls with a sponsor or a peer or a therapist. Remind the patient, if they experience a relapse, they can reach out and reflect without shame. Revise the plan and try again. Signs and symptoms of non-substance addiction. STDs, continued behavior despite negative consequences such as foreclosure or bankruptcy. Neglect of responsibilities, preoccupied with a topic, low self-esteem and shame, irritable when behavior is interrupted or mentioned. Types of non-substance addiction include gambling, sex or pornography, gaming, social media, shopping or spending, exercise, or food-related such as binging or emotional eating. Signs and symptoms of alcohol withdrawal. Agitation, anxiety, insomnia, delirium, mild to moderate or severe tremors, syncope, hypertension or hypotension, and delirium tremens, DT, which is a rare but critical complication of alcohol withdrawal that includes shaking, hallucinations, and nausea. It can be fatal, delirium tremens. What medications are stimulants? They're prescribed for ADHD, narcolepsy, and depression, and over-the-counter foods and drinks and illicit drugs. Amphetamines, dextroamphetamine, methylphenidate, modafinil, caffeine and nicotine, cocaine, methamphetamine, MDMA, which is ecstasy, heart rate up, blood pressure up, alertness, energy, focus, appetite down, risk of dependence, and withdrawal. High doses can cause anxiety, paranoia, arrhythmias, and seizures. What meds are SSRIs, which is selective serotonin reuptake inhibitors? Mostly given for depression, anxiety, PTSD, OCD, panic disorders. This is fluoxetine, sertraline, citalopram, escitalopram, paroxetine, fluvoxamine. They inhibit the reabsorption, which is the reuptake, of serotonin in the brain, causing serotonin levels in the synapse, which helps improve mood and emotional balance. So it increases serotonin. Okay, medication is clozapine. This is an atypical antipsychotic used to treat resistant schizophrenia and recurrent suicidal behavior associated with schizophrenia or schizoaffective disorders. Highly effective and is often the last line option. Lithium levels should be 0.5 to 1.5. Outside of these ranges are too high or too low. Bipolar is most often prescribed lithium. Early toxicity is 1.5 to 2. Nausea, vomiting, diarrhea, polyuria, polydipsia, fine hand tremors, muscle weakness, lethargic, slurred speech. Moderate toxicity is 2 to 2.5. Coarse tremors, confused, disoriented, ataxia, muscle twitch, GI upset, and sedated or drowsy. Severe lithium toxicity is 2.5 or more. You're looking at seizures, coma, death, renal failure, cardiovascular collapse, delirious, and hallucinations. What is agoraphobia? Agoraphobia is fear of being in situations where escape might be hard or help unavailable. It often includes crowds, public transport, or open spaces. What are the physical complications of heroin? Well, it can cause respiratory depression, and that's because it's an opioid. The medication is phenelzine. This is a powerful Maui monoamine oxidase inhibitor, which is an antidepressant used when other treatment for depression hasn't worked, especially in treatment-resistant depression or atypical depression, and occasional panic disorders. It blocks the breakdown of serotonin, norepinephrine, and dopamine, which in turn will increase levels to the brain and improve mood. They must avoid tyramines, which is aged cheese, cured meats, fermented food, red wine, draft beer, and overripe fruit. Identify the signs and symptoms of various abuse types. So you would be looking at a patient that has ripped or torn clothing, broken eyeglasses, disheveled hair or clothing, burn marks, lacerations, fractures, puncture wounds, and wounds and bruises in various stages of healing. Changes in their usual behavior, such as social withdrawal, non-responsive communication, little or no self-esteem, anxiety provoked by the presence of certain people, claims of enduring verbal or mental mistreatment, sudden fear of people or places, regression such as bedwetting, discomfort in genital area, and unexplained STIs. A child should never have an STI. Abuse, sexual, does not have to be physical touch. It can be indecent exposure, coerced nudity, and taking non-consensual photos that are sexually explicit. Medication is disulfiram. This assists with alcohol abstinence, but if alcohol is taken, the patient will have flushing, sweating, headache, nausea, vomiting, chest pain, palpitations, weakness and confusion and blurred vision, hypotension, collapse. It can be life-threatening to have disulfiram with alcohol. Avoid mouthwash, cough syrup, vanilla extract, hand sanitizer, cologne, fermented foods, obviously wine. It can be hepatotoxic. Common herbal remedies that interact with drugs are such as psychopharmacological drugs can interact with St. John's wort, ginseng, chamomile, echinacea, and there are more, but those are the most common. Now, we'll look at this real quick. Okay. DNEG-A. GABA, serotonin, dopamine, norepinephrine, epinephrine, glutamate, acetylcholine. Greg's train doesn't need extra gourmet apple pie. This video was made for me, by me, with notes from lecture and from the textbooks, so I can study and understand mental health. Thank you.